is Dr. Cozy. It's really nice to meet you. Can I just get you to verify for me your name and date of birth real quick? Perfect. Thank you. And okay, let's see here. So you're having some sinus pressure and feeling some pressure in your ears as well. Any diminished hearing? Okay. And how long has this been going on for? Do you have any history of ear infection or sinusitis? Okay. And have you had any imaging done of your sinuses, like a CT, X-ray? Okay. Who is the physician? I will give them a call and see if we can't get a copy of your film sent over. Okay. So you've been taking a decongestant as well as an anti-inflammatory medication. Do you feel like those medications have helped you at all, or temporarily? Okay. Okay. Well, let's get into it. First, I just need to put on some gloves. This new box has had these gloves sort of smushed together, making it a little tricky to put them on. But we did it. Okay, so to start real quick, I just want to take your temp, okay? Just to rule out any sort of bacterial process. And this is not going to make any physical contact with you, okay? It's just going to hover over your forehead. Just move your hair slightly here. Okay. Well, you don't have a temperature, so that's good. So where on your face are you feeling the pressure? Okay. Is it okay if I touch you? Thank you. So here. Okay. Any tenderness or discomfort here? How about here? Okay. Just pressing on your nose, your adenoid and sphenoid sinuses. majority of your discomfort is coming from your frontal sinuses, it would appear. Are you having any sort of sensation of a toothache at all? That's a common symptom. Okay. I'm just going to be feeling your face and down your neck, along your jawline for any sign of an inflamed lymph node. So, starting the infraorbital area, which I don't expect to see anything here. Okay. And then moving to your parotid, to right in front of the ears. Down your jaw. Just feeling along your clavicle. I'm not feeling, excuse me, I'm not feeling any presence of any kind of lymphadenopathy. Okay. So then let's take a look inside of your ears. Actually, before we do that, I'm going to take a quick examination of the external portions of your ears, okay? So, first, I'm just taking a visual examination. Just looking at the symmetry here. Okay. So, let me know if there's any sort of sensation of tenderness or discomfort, okay? So, just checking the cartilage. feeling any sort of issues in the cartilage, so that's something we can rule out. Okay. So now I'm just going to take a peek inside of your ears, okay? Closer here. You'll feel my otoscope. Feel my otoscope entering your ear. Is that okay? Is there any sort of discomfort here? Just taking a look inside, and there is actually quite a bit of cerumen inside of your ear. Earwax, which is preventing me from getting a visual of your eardrum here. I don't see any redness or induration, which is good, but I would like to be able to see if there's some kind of fluid inside of the ear. Let's check the other side here. So, again, feel my otoscope inside your ear. And is this side okay? Any discomfort or tenderness? Okay. Same on this side. I don't see any erythema. I don't see any induration, swelling. But I do see a lot of cerumen on this side as well. Okay. I think we're gonna need to do an ear cleaning for you to see if we can make ourselves sort of a tunnel so I can see if there is any kind of that got stuck. If there's any sort of fluid around the tympanic membrane or your eardrum, which would indicate an ear infection. Are you having any discomfort when you swallow? Okay. Are you feeling like your ears are popping at all? Or okay. And how about any postnasal drip? Okay. I'm gonna take a look at your throat in just a moment here, but first real quick, I'm just gonna see if I can't remove some of that just using a pick. I'm just gonna grab a paper towel so I can have something to wipe my pick with. I'm going to start with your right ear. Okay. So, if at any point this feels uncomfortable or painful, especially, I want you to let me know right away, okay? Don't be afraid, because actually knowing if there is tenderness inside the ear is a good clue for us to come up with a diagnosis. So is that okay? Side is pretty impacted, which is making it difficult to remove. Check the other side. See if this side is any different. So, again, any pain or discomfort there? Okay, good. Let's see if I can put some sort of area that I can remove some of the serum from inside of your ear, because it's definitely impeding my ability to see. It's definitely impacted on this side as well. Most likely we're gonna have to do some kind of soaking to try and loosen this up. So I am really not able to express much from the ear because it seems like the cerumen is pretty impacted. So what I'm gonna do is a couple things here. Put that to the side. So what we're gonna do here is I'm going to be placing some eardrops inside of your ears, which are going to be helping break up some of that earwax that's in there. Then I'm also going to be saturating 2 cotton balls with some hydrogen peroxide, which I will be placing in the ear as well to help encourage breaking up some of that cerumen, because I think the two working together will get us some better results more quickly. So first thing is these drops, and these also contain hydrogen peroxide as well, So you're going to feel sort of a fizzing sensation inside of the ears. It's not painful at all, okay? It's just kind of tickly, bubbly feeling. But no sting, I promise. Do the other side. Again, you're going to feel the tip of the bulb here. Okay. So those should be starting to fizz up a little bit. Yeah. Okay. Placing. Oh. Placing this. Right here. Okay. The left side as well. You are feeling a bit muffled at the moment. You're feeling some kind of sizzling in both of your ears, which is normal, and it might feel a little cold. All of those things are to be expected. Stand on. Know that. Okay. I'm going to take a quick peek inside your mouth, okay? Just get these open for me. Press down on your tongue. And we're going to take the throat here. One more time. A little bit of redness in the back of the throat, which could indicate signs of fluid draining, but we will be able to make an official diagnosis once we have your ears cleaned. And the other side as well. Okay. Let's take a look. Wax here is still in place, but it does look like it might have softened a little bit. Let's see on my pick here. How's this? Just a little bit. Let's check the other side here as well. So, this side looks the same. Still do is something called an ear lavage, which is where I'm going to be using water to flush the bulk of the wax out of your ears. Once we have that removed, then I'm gonna go in with a pick and just make sure that we have everything clean, okay? It's not painful. People say it just feels funny. Mostly it feels like just water squirting to your ears, and then you will eventually feel it sort of release once we're able to loosen and flush the wax out. So it's a little weird, and it's also very satisfying. First though, let me grab your drape. I'm just going to place this around you to protect your clothes. So, I'm gonna be tucking this into your shirt. Oh, come on. There we go. Okay. Making sure this is covering you sufficiently. Okay. I think we are go. So, okay. I'm gonna grab a basin here. So I'm gonna be using this guide to catch our drips. And this guy is going to be doing our lavage. Now I know it's a little intimidating in appearance, but I promise you it's nothing to be afraid of. It's just big. So that's light so I can see. I'm just gonna place this up against your chin, just like so. Okay, is that okay? Okay, it's not uncomfortable. Okay, because I can add a towel. So. Just like that. Then okay? It is weird. Alright. Should be quick. Let me grab a paper towel. that should help absorb any more of those strips. Placing this against your cheek again, and here we go. Alright, that should feel a bit better, yeah? Good. Okay. Now I'm going to move this basin over here as it is full. And we'll take our other one. We'll get another one here. Place it this side. Okay. So now I'm placing our empty basin against this cheek, like so. And there we go. Got that to release. Move this over here and that's our little this. As well as gonna go back in with my pick one more time just to make sure we got everything. So that okay now? Okay. So I think I got most of it. We don't need to remove all of it because some cerumen does act as a lubricant for the tympanic membrane, your eardrum. Every time you hear a sound, the membrane vibrates. And so it's important to keep it lubricated so that it's able to move properly, to have good mobility. So I'm going to be taking a look inside of your ears again, only this time I've attached my insufflator bulb, which, as you can see, blows just a little puff of air, just enough to create movement of your tympanic membrane, so that way I'm able to see if there is good mobility or not. If not, that can indicate the presence of fluid, which we will then follow up by doing a nystagmus test, which I'll explain in a moment. First, let's take a look. So it does look like there is a little bit of a limit to the range of motion of the membrane on that side. Let's compare it to the other side now. So I would say that there's definitely a limited range of motion to both of your eardrums. So I would like to be a little bit more certain in our diagnosis. So what I'm going to do is a nystagmus test. What that means is I'm going to be turning your head with my hands, okay? While I'm doing this, I'm going to be watching both of your eyes very closely. It's going to be like a real intense stare down here. But what I'm looking for is to see if your eyes flicker at all, which can indicate a loss of balance. have little granules inside of the ear that change position to help keep you balanced. When there is fluid present in the ear, it can impair their ability to do so, and thus you feel a loss of balance sensation upon having your head moved back and forth. Okay? So, we're going to start just by turning your head to the right. Then we're going to turn your head to the left side and back at me. How was that? Okay. So then we're going to do it again, alright? This time, I'm going to start by turning your head to the left and then moving your head to the right side and back at me. Yeah, I do see a little bit of flickering. Okay, let's try that one more time, okay? So, moving your head to the right and then to the left side, back again to the right and the left, and then back to me. Okay. You okay after that? Okay, good. So I do see a fair bit of flickering of your eyes, which would indicate that there was definitely a loss of equilibrium experienced. Would you agree? Okay. Are you feeling dizzy now? I'm sorry. One last one last test I want to do is I just want you to keep your eyes open. Look at my nose. I'm just gonna look at your eyes real quick, okay? So just keep them open. That's all I'm gonna do here. Is just flick the light in and out of your eyes. And then keeping your head square, don't turn your head. I just want you to follow my light for me. Okay. Perfect. Just needed to do a quick exam for your eyes just because you were experiencing some dizziness and we want to make sure that it is for sure due to fluid in the ears and not a neurological cause. Okay. I'm gonna write you a couple of prescriptions. The first one for some ear drops, so that way if that wax reaccumulates, you are able to help remove it. And then I will also be prescribing you a oral steroid to help clear up that inflammation and swelling, because I am not seeing any indication of a bacterial infection. I am not going to be prescribing antibiotics at this time, but if you do notice a change in any sort of drainage or you start experiencing fevers, then let me know right away and we will reevaluate. So, okay. Just making sure we have pharmacy listed. Which we do. Okay. Okay, so I will have a medical assistant get those called in since I step out. So I am prescribing a prednisone taper pack, which you will use as directed, and the pharmacist can go over that with you, but it will help dilate the vessels in the ear and allow for better drainage, and that way the irritation can go down, the inflammation can go down, and will get you feeling better. Okay. So let me just take off my gloves and pop those into the trash. So, do you have any questions for me before I step out? Okay. Well, if you think of anything, give me a call, okay? I will be giving you a call in a couple days to check in with you and see how you're doing. And in the meantime, if you have any sort of change in your symptoms or you think of any questions or concerns, please feel free to give me a call, okay? Okay. You take care. We'll get you feeling better, I promise. Okay. Hey. I'm Dr. Cozy. It's nice to meet you. How are you? Good. Did you find our office okay? Good. Okay. So, looking here at your paperwork, it says that you're here due to chronic tinnitus, correct? Sorry. How long have you been having this? Wow, okay. And can you tell me what treatments you've tried, which therapies? And do you feel like any of those things helped alleviate the ringing at all, or? Okay. Well, we do some alternative therapies here that do have a good efficacy. Some people do experience a complete, their tinnitus just completely goes away. And for others, it is just a reduction, but it does improve their quality of life. Some of these treatments will need to be repeated, generally over a 9-week basis. Some that we will try will only need to be done the one time, unless you develop more ringing in your ears later on, okay? So first thing, let me put some gloves on. First thing I'm going to do is a pretty thorough exam of your ears, both the internal and external. Attach my insufflator bulb. Okay. So this is an otoscope which I will be using to look inside of your ears. And as well as looking inside of your ears, I will be using this insufflator bulb, which blows a little puff of air inside, as well as using this little tuning fork here. And the purpose of these two things is that I would like to see how your tympanic membrane, your eardrum, vibrates or moves in accordance to each. So the puff of air is just going to cause it to move just a bit. The tuning fork will create a vibration. And what that lets me do is assess the mobility of the eardrum and determine if there's anything like fluid present which would prevent full range of motion. Okay? Okay. So, I'm going to start on this side. And I'll feel otoscope entering your ear. To start and just getting a visual of the internal structure, the external meatus or the ear canal. Just seeing if there's any sign of red gonna try looking with the tuning fork now, okay? So it's just a light tone. Alright. So it does look like your eardrum is vibrating and moving well. Oops, okay. Sorry, I keep saying oops. So let's take a look at this ear now. Is there any tenderness or discomfort when I insert the otoscope on this side? Okay, good. Now we're looking at the external meatus on this side, the ear canal. Looking at your tympanic membrane. I don't see any signs of redness or swelling on this side. So we're gonna feel that puff of air again. That's okay. It looks like the tympanic membrane is moving properly, so let's look with the tuning fork here. So okay. Oops. Let's try that again. Okay. So it does appear that each of your eardrums is vibrating and moving correctly. Which rules out an issue with the mobility. I'm gonna do a quick test just to rule out completely any sort of fluid in the ear, which is going to be, I'm going to be turning your head to the sides. I'm going to be watching your eyes very, very closely, looking for something called nystagmus, which is when the eyes flicker due to a loss of balance. Okay? Okay. I'm going to place my hands on either side of your head, just like that, just to sort of help limit any dizziness. I'm just going to start with small turns. Okay. So how was that? Okay. I'm going to try it again. A little bit bigger this time. Still okay? Okay. Try it one more time here. It's a bit bigger, I know. Okay. How's that? Good. Looking at your eyes here, I don't see any sign of nystagmus. So that does help rule out an inner ear infection. Just take a quick minute. Okay. So now I just need to take a look at the external portion of your ears. Due to the nature of some of the tests that we will try, some of the therapies actually, I will be placing things around the ear, and I need to make sure that there are no issues in the skin, like acne, for example, or a break in the skin, which will complicate the placement of some of the devices, okay? None of them are painful, promise. But I do need to check. So, just gonna be taking a look here. Take a look at the other side as well. Okay. Everything looks intact. I'm not seeing any sort of breakage in the skin or infectious processes present, so that's good. So, okay. Now what I'm gonna do is just gently clean around the ear, okay? Okay. Grab you. we're going to be trying 3 different therapies. The first one is something called cupping, which will be using negative pressure on the ears to increase circulation, promote angiogenesis, which is the production of new cells from existing cells, to try and cessate the tinnitus. Second therapy we'll try will be using ultrasound waves. So I will be putting conductive gel around your ear. So my transmitter can, or my transducer rather, and waves through to also help increase the circulation. And the third one will be using infrared radiation to do the same thing by encouraging inflammation, which helps dilate the vessels to allow for increased circulation to the ear canal. So, the first thing we're going to do is I'm going to be placing these cups over your ears. Okay. This, while it looks a bit scary, is just basically creating these suctions so that way they can stay in place as well as do their job of creating that negative pressure, okay? Okay. It's not painful. It might feel a little funny, but it won't hurt. So, starting with this side. Okay. Let's grab the other one. Alright. Sit on my ear for just a few moments, and we'll take it on again. you taking some notes for me? Alright. So, how are you feeling? Do you feel any improvement in the intensity of the ringing in your ears? Okay. Well then, let's go ahead and try ultrasound, okay? Okay. So. Just going to be placing some conductive gel. Under your ear. Okay. So then, this is not the type of ultrasound where you will see images on the screen. Rather, we are using the ultrasound waves as the therapy. It should not be uncomfortable, just a little bit of pressure, but it should not be unpleasant, okay? Okay. So, starting. That okay? Good. Get just a little bit more gel here. There we go. Right. So then the other side here. How are you feeling after that? Do you perceive any sort of noticeable change at all? Not really? Okay. Gonna take a quick look inside of your ears. The otoscope again, just to see if I can see any discernible changes.
Everything does look about the same. I don't see any sign of irritation. There's a little bit of increased inflammation in this ear, which is actually what we want to see.
Let's take a look on the other side.
Okay, so looking on this side, I do see some inflammation and redness, so it did encourage increased circulation to this ear. It's just less effective on the other side.
Okay. Definitely don't want you to feel imbalanced, so we will be trying the third therapy. First, let me just take a quick note. Okay. All right. So, going to be doing infrared radiation using a low level laser into your ear, okay? Going to be aiming it through the external medius at the cochlea, which is a fluid-filled cavity inside of your inner ear. It helps with, plays a critical role actually in allowing us to hear. So, just need to get a couple of things just to ensure your comfort and safety. It is a safe procedure, but we want to make sure that your eyes are protected. So, just a moment. I'm going to be placing some protective mesh covers over your ears. glasses are going to help protect your vision here, okay? And I will be wearing protective goggles as well. So you will be hearing sort of buzzing sound, and it might feel a bit warm, but you shouldn't feel any sort of pain or discomfort, okay? That was the first ear. So now I'm going to do the second ear. Alright. So is off here, okay? Gonna remove take off my old glasses here. Take another look in your ear.
So now I do definitely see an increase in redness and swelling on this side, which is exactly what we wanted. But
Insert it again just to make sure that the tympanic membrane is still able to move correctly.
good, so we still have proper mobility.
Check the other side.
I'm seeing the same redness, same inflammation on this side as well. Trying to insulate. Good, okay.
So the mobility of your tympanic membrane is intact. So that's great. I do see a definite inflammatory response present, which is also great. Do you feel like there is a diminish or complete loss in the ringing in your ears? It's definitely quieter. Okay, that's good. So then it would appear that the irradiation therapy is what works for you. So, sorry, my stomach. this therapy does need to be repeated once a week for the following 9 weeks, okay? At the end of that time, we will re-examine and reassess you to see if we need to go through another bout of treatment or if the tinnitus has completely resolved, okay? Okay. Note from here on out, when you come back in, it'll be a very quick visit, probably about 15 minutes tops. We will just go directly into the light therapy, the laser therapy, and then you'll be able to go. Okay. So on your way out, you will need to stop at the front scheduling desk so they can get you some times booked and to make sure that you're able to come back at the same time every week. Okay. Do you have any questions for me before I step out? Okay. Well, if you think of anything, you can always ask me next time you come in or give me a call. Okay. Well, it was really nice to meet you. And I'll see you next week.
Hey. How are you doing? Yeah, it's that time. Every other night, we have to clean your ears out. How's your head right now? Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt, can you tell me what your pain level is at? Okay, that's pretty high. Okay. She did. Okay. Well, then that should kick in soon. Do you still need me to whisper, or? Yeah. Okay. You're a bit sound sensitive. Okay, that's not a problem. That's not a problem. If you need me to stop talking completely, I can do that as well. Okay. You just let me know, alright? Okay. So, let me move some stuff so I can set your chart down. And of course I dropped the glove on the ground. How are you feeling otherwise, aside from the headache, sinus pressure? Okay. Are you still having chills? On and off. Okay. I can get you another blanket if that helps. Okay. Well, you just let me know if you need one, okay? Okay. Just listen to your chest real quick. Okay. Take a deep breath in for me, okay? Good. And out. Okay. And again. And out. And again.
So that,
Sorry, so that should feel a bit better, yeah. Okay, good. Which means also now I can take your temperature. If I could get this off the cradle, that would be great. want you to tell me which side you feel my cotton ball on, okay? I'm just gonna lightly brush it against you. Good. Okay.
just get you to verify for me your name and date of birth real quick? Thank you. I know, but we have to do it every single time. It's one of the ways we make sure that your identity and all of your information stays safe, okay? So, alright. I have you here today for a pre-surgical consult for ear reconstruction. So what that means is we're going to be doing a few things. I'm going to be taking some pictures of your ears and surrounding facial structures. We're also going to be doing some x-rays, so taking some internal pictures. I will be examining the ears both inside and out, looking for anything that might cause a complication or might require me to change my technique. And then I will be also taking some measurements of your ears just to make sure we have all of the information before we go in, okay? Okay. Do you have any questions before we start? Okay. Well, if you happen to think of anything, just go ahead and feel free to ask, okay? So let me just take a look here at your medical history. I don't see any sort of contraindications, so let's go ahead and get started. So the first thing we're going to do is I'm just going to be taking some photos, okay? Just with a regular old camera here. So you don't have to do anything, okay? Just going to be moving around you and taking some pictures here, okay? Oops. And then turning the camera off because, of course. Okay. Alright. Once more feeling. Okay. a quick look here. Okay, I think I have just about everything I need, but I'm going to take a picture of you just straight on and just relax your face, okay? You don't need to smile or anything. I just want to get an image of the symmetry of your face. So okay, perfect. So that's everything we need for that. I will get those uploaded as soon as we are done here. So I'm just gonna grab some gloves. So, is it okay with you if I touch your ears? Thank you. It's just important that I make sure that there is no evidence of scar tissue or keloids, anything that might change the outcome or require a different technique going in, okay? So, first I'm just taking a look. Just getting an idea of the symmetry of how your ears making sure that we're thorough here. Okay. Not feeling anything that would be a contraindication or would concern me, so that's good. Okay, so then just gonna get an otoscope so we can take a look at the inside, okay? So, we left an old cover on here. Get a new one. And we will be doing a thorough cleaning before your surgical procedure. We're not going to do that today, but we will make sure going in that everything is perfectly clean. Okay. So, let me know if this causes any kind of tenderness. Should not. Okay. So just taking a look inside of your right ear. Looking for anything like a narrowing of the meatus or the ear canal. Any sort of condition or structural abnormality that might affect the surgical outcome or technique used. I'm not seeing anything in that regard here. The inside of your ear looks nice and healthy. Check the other side here as well. Positioning the otoscope in a way that lets me get the best visual here. Looking on this side now to see if there's any sort of difference or change compared to the other ear. The internal ear on this side looks good. I don't see any sort of inflammatory processes or erythematous skin. Anything that would be a concern. Okay. So I think in regards to the insides of your ears, we are good to go. At least on otoscope exam. Just a quick note here. gonna go ahead with the x-ray portion. So let me just really quickly doff my lab coat here and don some protective x-ray gear. I have this lovely, attractive, protective agent for you. So, just put this around you. So, trying to jostle you here. Just want to make sure that we protect your thyroid. And it looks like an hour. Good. So, going to position your head here. Like so. Pull. It's gonna be right up against your ear like this, okay? Okay. So I'm gonna have you stay very, very, very still for me, alright? Put a hand behind you. Okay, you can relax. And again. Okay. Keep still. Great. Okay, reposition this one more time. Actually, two more times. So. Turn your head just so slightly to the side. Perfect. Okay. So hold just like that, okay? Relax. Now, going to position your head just like so, right here, okay? Position it just like so. Let's change the angle slightly. Perfect. Okay. Great. Stay very still. This is the last time. Relax. Parts. Move this out of here, out of your way. Go ahead and remove your apron here. Mine is 2. the Velcro here. Okay, so we are going to start the measurements. I'm just going to start my data entry program real quick. Bluetooth keyboard here, so real quick I'm just going to be entering your name. Okay. So, to start, I'm going to be using just a ruler here to take some measurements of different points on your ears, alright? So, this is probably going to take a little bit to get through, but it's not going to be invasive or anything, I promise. So, start on the right here. Okay. Lining it up. Okay. Okay. Take the same measurements on this side as well. So you're almost symmetrical. with this guy, and then we're gonna switch. Positioning this. Okay. Right. And on the other side, we'll get the same. Alright, cool. You to the side. Moving back. So this measuring tape is not my favorite because it sticks, but I need to use this guy to get the curved measurements at the curvature of your ear, as well as in terms of the facial placement of the ears to measure the symmetry. So I'm gonna feel possibly the tape going around your ear. And on this side now. And more sticking. There we go. Same both sides. measure real quick. Clear your hair just a little bit. So now I'm going to be measuring different landmarks on the face, okay, just to have data about the placement of your ears on your face. So first I'm going to go ear to ear across the eye line. And again, to make sure we get the same measurement, starting from here to here, which we do. Okay. And now I'm going to do that same measurement, but different angle. Opposite direction to make sure we get the same. A little lower. Oh, stop sticking. Yeah, we do all measurements twice, so that way we can avoid human error. Okay. So now do lengthwise. I know my tummy is a bit rumbly. Seems to be the pattern when I drink coffee. That peristalsis. Some of these are a little awkward, I apologize. Hair out of my face. Just making sure I haven't missed anything. It doesn't appear that I have. So good. Okay. So we got 2 more to do here, alright? You're being a great sport. I know this is kind of boring, but it's important. So that way we make sure we get exactly what you want. I want to make sure that you feel comfortable and confident going in here, and also that you'll be happy with the result. Okay. And our last one. protect your privacy. Just need to take a quick note here. Okay. Just checking here. Would you like to have your consult notes and findings forwarded to any physician? Okay. What's the name? Okay. Do you have a phone number for their office? Yeah, go ahead. Perfect. Okay. Okay. All right. Anybody else? Okay. And then I do have here that we're going to forward to your ENT as well. Okay. And I will be forwarding a copy of the films to both of these physicians via courier, so they'll be able to take a look at them themselves. So then, just going down the checklist here. We're also going to have you do a consult with your anesthesiologist. They will have their own exam and series of questions for you. It's very important that we get all of the information we need to make sure that your surgery is successful and that you stay asleep while you're under anesthesia. Yeah, definitely ideal, isn't it? It is definitely a common concern for all of our patients, which rightfully so. I'm going to get all of this information, data entered into our program, okay? And then myself, your anesthesiologist, we will be going over and reviewing the information together, okay, to make sure that we have everything and coming up with a surgical plan for you. Once we have that put together, and it generally doesn't take any more than 48 hours, you will receive a phone call from our surgery scheduler to schedule your procedure, okay? Yeah. The healing window is actually not very long, it's pretty quick. Generally, people are back to normal, no more scars or symptoms within 4 to 6 weeks. So, should not be too invasive in terms of your lifestyle. So, okay. Do you have any questions for me before I step out? Okay. Well, you can always give me a call should that change, alright? Okay. You take care, and we will be in touch very soon. Promise. You awake? Oh, good. Okay. Good. Your vitals look good. Oxygen saturation is back up. Looks like your blood pressure has gone down as well. So that's good. How are you feeling? I know, nobody enjoys being in the hospital, but that's okay. So, today, however, is a good day for you. We're going to get your sutures out, so that's exciting, yeah? It's the little things, okay? You gotta hold on to the little things. Let me just look through my notes here. Okay. Well, we can get this show on the road. So, let me just glove. Aside from being sick of being in the hospital, how are you feeling? Okay. What's your pain level at currently? Okay, that's better. Good. Okay. You know the drill. I just want to take a look at your eyes, okay? So just keep your eyes open. Good. Other side. You know that drill. Keep your head square. Don't turn your head and just follow the light. the edema has definitely gone down. That's good. Okay. Listen to your chest, okay? Take a deep breath in for me, okay? Good. And again. Good. And again. Okay. Listen to your belly. Everything sounds nice and normal. Okay. Any tenderness? Okay. Good. Let's take a quick note here. So, just gonna grab a few things, okay, so we can do your ears. Don't worry. These are just syringes filled with water. So, no needles, I promise. Okay. So first, take a look in your ears. I promise. I'll be very gentle, okay? So.
The interior of your ear looks good. Don't see any redness or swelling here. Nice and clear visual of the tympanic membrane. Looks like the erythema that was inside the ear has cleared up. That's good.
I'm looking at the outside. Little bit of pinkness, but it doesn't look nearly as angry as it did. That's good. Other side.
This is okay on this side. No pain. Okay, good. Looks like the redness has cleared up on this side as well. No cerumen. Scratch that, minimal. I can still clearly see the tympanic membrane on this side as well. No drainage.
On the outside of the ear. This side is pink too, but don't see any signs of swelling. Good. Alright. Okay, so I'm gonna go ahead and remove the bandages, okay? Looks like we lost a light. It's okay. Just looking. Yeah. The incision is nice and healed up. Don't see any sign of keloid forming. We will have to clean the area of the sutures before we remove them. There is a little bit of scabbing here, but that's not a big deal. We can clear that up with some hydrogen peroxide. Okay, to the other side. Okay. This side looks good too. I'm gonna need some hydrogen peroxide on this side as well. So let's get that part started, okay? Very lightly, just dabbing. If there it goes fizzing up a bit, so it might feel a bit on the tingly side. That's normal. No, this shouldn't be painful at all. There might be like a little bit of pressure and pulling that you feel, but it's not going to feel painful, okay? we shouldn't need to numb you. Ready? is nice and closed on this side too. So, to take a quick contrast drainage. Now everything is nice and dry. There is some scabbing still, so I'm just going to take a quick swab of that, okay? Just to make sure. And you are still staph free. I'll do it on this side since I'm here. We'll also do the other side. Just going to use this to protect your face. I'm going to use some of this sterile water just to loosen up and clean off the incision sites. Okay. The water will be really gentle, so it shouldn't be painful at all. Just make sure that it's gonna come out. I'm just squirting. Okay, there we go. Okay. turned up. Okay. suture free, so that's good, right? So, we are going to be monitoring your ears though over the next 24 hours or so, just to make sure there's no signs of recurring infection. Okay? So, we're going to be looking for any new redness or spreading redness. If the skin feels warm, if there's any kind of swelling or drainage, okay? If you notice any before a nurse or myself do, then I want you to let us know right away, okay? Okay. Just take a few notes, alright? Okay. Is there anything that I can get for you before I step out? Okay. You're warm enough? Okay. Good. Well, if you do need anything, go ahead and push the call button. Okay? As you know, it'll call the nurse's station and they'll come right in. So, sure. Grab your cultures. We'll get those sent off right away. And I'll come back in when we have results and let you know what they are, okay? Okay. I'll check back in when I round next, probably in a few hours. Okay. Okay, so really quickly, I'm just going to take a quick temperature in each of your ears, okay? Shouldn't be uncomfortable. Okay. On the other side. both sides show a normal temperature, which is good. It helps us rule out any kind of bacterial infection. Gonna take a look inside of your ears, okay? Let's see if there's any type of fluid inside the ear that I'm able to visualize. Don't see any, but there is a considerable amount of serum in the ear, which is making it hard to see more than superficially. Check the other side as well. Is this okay? Is there any tenderness or discomfort? Okay. Seeing the same thing on this side, it's hard to get a clear visual due to the amount of earwax in the ear. Okay. Put that to the side. Take a look in your throat, okay? Since I'm not able to visualize into the ear to see if there's fluid. Perfect, thank you. This way we can see if there's any drainage down the throat. There's a little bit of redness, but I'm not seeing any active postnasal drip. That redness could be from other irritation, or it could be indicative of drainage. Okay. Relax. You said you're not noting any sort of diminished hearing, just a sense of dizziness, imbalance. Okay. Let's do a quick hearing test just to rule it out, just in case something is going on that you're not completely aware of. Sometimes with diminished hearing, you don't realize right away. So, I'm going to be placing these earphones on your head, okay? Just like so. I'm just going to start up my program really quickly. One moment. So when you hear a beep, I want you to raise the corresponding hand to which side you heard the beep on, okay? Should be starting. Good. Just gonna take these off of you now, okay? Okay. So you did get 8 out of 10 correct. Some of them are at a lower pitch, so it can be difficult to hear them even with healthy ears. So I'm going to be doing a whisper test just to get a more comprehensive result. So I'm going to whisper a word in each of your ears, and I want you to repeat that word back to me, okay? So, to start, cucumber. Try one more time on the side here. Basket. Okay. Plastic. Papaya. Okay. Radioactive. Okay. I'm gonna do 2 more. So, bubblegum. Okay. Last one. Discount. Okay. Those you got completely correct. So, and then one more test I'd like to do to rule out fluid in the ears. I'm going to be turning your head, okay? And while I'm turning your head, I'm going to be watching your eyes very, very closely. I'm looking for any kind of flickering, which we would call nystagmus. And this can indicate to me whether or not you are experiencing dizziness with turning of the head, okay? Okay, so just like so, very slowly. Okay. There are these tiny parts in the ear that move to help us maintain our balance. And if there's fluid in the ear, their movement may not be functioning correctly. A little bit of a bigger movement now, like so, and the other way. To relax for just a moment, okay? How do you feel right now? Are you okay? Do you feel an increase in dizziness? Okay. We're gonna do this one more time, okay? So, nice and slow. Turning your head. Okay. And the other side. You're still okay? Okay. Gonna look in your ears again. See if there's any discernible change. Let's see here. This looks the same as it did before. Not seeing any sort of shift. Other side here. Yep, same for this side as well. Are you feeling any kind of difference? Actually, I'll leave the cover off this time. Leave the cover on, rather. Okay. So there is a considerable amount of cerumen in the ear, which could be contributing to the loss of equilibrium. I'm not entirely certain that's the case. So what I would like to do is clean your ears a little bit, okay? See if we can't get a better visual of what's going inside the ear. Normally, we would do this by irrigating. Since something called an ear lavage where we use water to flush the ear. However, because you have a history of ear infection and fluid in the ears, I prefer not to use water to potentially aggravate something that's existing. So I'm going to try it to start by using an ear pick. See if we can't pull some of that out. If I'm not able to do so that way, then I'm going to be using an instrument that sort of serves as a ear vacuum. But to start, let's see if we can't just use a little pick. I'm going to grab a tissue. This guy's just like a little scoop. Okay. So, if at any point you feel any sort of pain or discomfort, I want you to let me know, okay? Okay. So then what I'm going to do is just place a few drops in your ears, which is going to help with breaking up some of that earwax in the ear. First I'm going to place a tissue on either side, so that way if it drips it doesn't get on your clothing, okay? Just like so. So it's going to take a few moments to work. You're probably going to hear a bit of a fizzy sound in your ears, which is totally normal. That is the sound of the cerumen being broken up. So while that is working, I am going to take a look at the exterior portion of the ears, okay? Make sure there are no abnormalities or sign of an external infection. Just feeling along. Cartilage. noticing any sort of sign of external infection or irritation that concerns me. So we can roll that out. Then, real quick, I'm gonna check and see. If we've made any kind of progress here, okay? So, oops, let me just get a little closer. Okay. Hopefully my chair doesn't break. Not really getting much down here. I think the same on this side. Let's see. Same on this side. Yeah, it's about the same as it was before. Same with this side. I'm not really seeing any sort of improvement. So, okay. I'm gonna put one more set of drops in the ears. See if we can't help this along. So I'll let those work. while those are continuing to work, I'm going to be feeling along your face, your jawline, right in front of your ears, down your neck, and across your shoulders. I'm looking for any sort of sign of inflammation or presence of lymph nodes that could indicate an infection, alright? Starting with the parotid, right in front of your ears. And along the jawline. Your clavicle here, the collarbone. I'm actually just going to feel under your arms really quickly, okay? I'm going to try not to tickle, but it's unlikely an ear infection would contribute to maxillary lymph nodes, but just want to check. I'm not feeling anything. It's okay. I'm going to test with my ear pick one more time just to see if these are ready for more in-depth clearing, okay? Or cleaning. Looks like it's a bit more broken up on that side. Check this one. Okay. So it looks like we're ready. There. Oops. Okay. So this here is an ear vacuum. So this tip is going to go right in your ear. And as you can see, it's quite flexible and soft, so it shouldn't cause discomfort. There might be like a slight sensation of some pressure. It might even feel kind of tickly. If at any point you feel pain, though, I want you to let me know. This should not be painful. So, it does make a bit of a noise. I'm going to try to hold this part away. You should just hear sort of a suction sound, okay? Okay. And we're gonna check the other side, okay? Or try the other side, not check it. Look again. go back in one more time with the pick. Okay. So let's see. We can't clear out the rest of this. Just get a little closer, to protect my back. Okay. Okay, much better. Go on the other side here. How are you feeling right now? Are you okay? You're not feeling dizziness or any ear pressure? Okay, good. Looks like we lost the tissue on your other side. I'm gonna grab a little brush here. Pretty tiny. It's gonna help me scoop out anything additionally that's in there because these little bristles are just gonna pick it up very lightly without pushing it further into the ear. So this might feel a little tickly. one really quickly with a tweezer. Because there's just a little left, I think, in here that I'd like to. Other side. Oops. I almost launched myself off of my chair. Look inside again. Let's see. All right. So is it okay now? Still not feeling tenderness? Okay, good. Yeah, your ears are moderately clearer. I don't see any fluid, but I do see some swelling. That could be present because of the amount of earwax that was in the ear. To the other side. Seeing the same thing on this side as well. No fluid present, but I do see some redness and swelling, which again could be a result of the impacted wax in the ear causing irritation. I'm gonna apply the eardrops one more time to sort of help flush out any remaining wax, okay? As well as help keep your ears nice and clean. Since often, if we have enough cerumen in the ear to difficulties, it can reoccur. So. Cool. This should be less fizzy this time. Okay. Then I'm just going to take a quick clean of the outer portion of the ear. That's okay. Just using a cotton tipped applicator here. Do there for a moment. Okay. How do you feel right now? Okay. So you feel a little bit more comfortable? Good. Alright. I'm going to do a few more things to examine. Just to make sure that we are really thorough, okay? I'm going to check one more time for drainage in the throat. Yep, perfect, thank you. Okay. Just seeing if anything has developed due to having your ears cleared out. Sometimes if earwax is trapping any fluid, it'll release. But I'm not sure I'm seeing anything like that here. I'm going to be turning your head again, okay? Same thing as last time. I'm going to be watching your eyes really, really closely. Making sure I don't see any kind of flickering. So, are you ready? Just like so. Good. Let you relax. Just a moment. How do you feel? A bit dizzy? Okay. Let's try that one more time. The dizziness could be from the change in pressure in your ears. Now that that wax has been cleaned out. Look at your ears again and see if that is the case. This feels okay. Is it uncomfortable at all? Okay. Okay. It is quite deep in the ear, but I do see what I think is a little bit of fluid present. Yep. There it is. Okay. Check the other side and see if it's bilateral. Okay, yep. I see it on this side as well. So, my dear, it would appear that you have a double ear infection. I'm going to take a repeat ear test, ear temp. Because my guess is that the presence of the wax prevented us from getting an accurate measurement. Let's verify that, shall we? Okay. So, just placing the thermometer in your ear. There it is. Low grade fever. Check the other side as well. We have an elevated temperature in both ears. Okay. I'm going to repeat the hearing test one more time just to make sure there are no changes now that your ears have been cleared out. Given that there has been a change in the state of the body. So I'm going to place my earphones on your ears again, okay? Let me just start my program again. So again, you know the drill. Raise the corresponding hand to which side you hear the tone. Should be starting. Okay. Take these off of you now. So this time you got 7 out of 10, correct? So it looks like now that fluid's been allowed to move into the ear, your hearing is diminishing a little bit. Yeah. Okay. Let's try the whisper test one more time, okay? So, let me know what word you hear. Just repeat it. Dictionary. you were able to discern the words that I said, so that's good. Okay. So then, are you feeling any sort of congestion now at this point? A little bit. Okay. Any feeling of sinus pressure? Let's check, okay? I know this is a bit of a lengthy exam, but I don't want to miss something and then send you out of here and have you feeling extremely uncomfortable later. So I'm going to be pressing on different portions of the face where your sinuses are located. It's normal for it to feel a little bit like pressure, but it shouldn't be painful or sore or achy. So if you feel any of those things, I want you to let me know, okay? So I'm going to start on the forehead. Just here. And I'm just lightly pressing. Any soreness? Go down the bridge of the nose. Feeling your adenoid and sphenoid. How about there? Any sort of pressure? A little bit, okay. See your cheeks. How about those areas? A little bit. Okay. That would be your frontal sinus region. Okay. So it appears to me like now that we've released the clogs, so to speak, in your ear, the actual underlying infection has presented itself. And check your throat one more time, given that now you're experiencing sinus pressure. Okay, open up. Okay, yeah, now I'm seeing some drainage. Probably fluid from the Your nose feeling plugged? I can hear it in your voice a little bit, yeah. Let's take a quick look. I'm just gonna go into your nostril, okay? Other side. Yep, okay. There is drainage starting to form for sure. Keep your eyes open. Making sure that there's no involvement of the eyes like conjunctivitis. So I'm just gonna take a look. Gonna get you to look up for me. I'm gonna hold your eyelids so that I can have you look down. The other side. Look up. Okay. I don't see any drainage present in the eye, so that's good. So, what I'm going to do is I'm going to write up an order to have you head down to radiology to get a sinus CT. It's quite clear that you have a double ear infection, but I want to verify for sure that there is a sinusitis involved as well. So, just get out a sheet for an order. Okay, I'm gonna get this order faxed down to radiology. It's just one floor below us, and there's a really large sign that will help direct you there. And then I'm gonna write you a prescription for these ear drops as well. Same pharmacy that we have on file. Yep, that's the one. Okay. also want to prescribe an antibiotic, but I'm gonna wait to do that. Let me grab a quick culture from you, actually, okay? Be right back. I need to grab a media transport tube. Oops. If this is in fact bacterial in nature, I want to make sure that we prescribe the correct antibiotics, so that way we don't put you at risk at any kind of resistance. And if it is in fact a viral infection, that way we are not giving you antibiotics that aren't going to actually help. So I'm gonna grab two actually from each of your ears. So, you ready? Shouldn't be uncomfortable. The other side. So I will take that with me and run its stat. It does generally take about 24 to 48 hours to identify a bacterium, and then it can take about 40 to 72 to be able to get the antibiotic sensitivities. So in the meantime, symptomatic treatment is going to be best using anti-inflammatories, as well as an analgesic to help control pain. You're going to want to alternate these. So you can start with something like ibuprofen, and then 4 hours later, acetaminophen. 4 hours after that, another ibuprofen. 4 hours later, acetaminophen. Okay? That's going to help provide you pain relief without putting you at risk for complications such as liver issues, which can be caused by too much acetaminophen. Okay, so just checking what we've given you in the past. Okay. So it looks like last time we gave you Augmentin. Okay. So we're gonna get that prescription called in for you for the eardrops, and we will get this culture processed as well. For now, I want you to head down to CT, to radiology, to have a CT done, okay? They will have orders down there by the time you get there. We're gonna have them faxed right away, okay? Okay. Do you have any questions before you go? Okay. As soon as I have the results back from the radiologist, I'm going to give you a call and let you know what the next plan is. For now, I just want you to sit tight. You can go on home and rest after the CT. Start taking an anti-inflammatory to help with some symptomatic relief, right? And then within the next few hours, I will be giving you a call to discuss the results of the CT scan with you. Is it okay to leave a voicemail if you're not answering? Okay. So then, once we discuss the CT results, we'll be able to talk about the next part of the plan. We won't have a definitive answer in terms of antibiotics until we get the culture results back. But we can at least provide you symptomatic relief until then. Okay? Okay. So, if you head out just the way you came in here, hop on the elevator and go down one floor. When you step out, you'll see the signs for radiology, and there's signs all the way there that direct you on where to go. Okay. So, we'll talk really soon, okay? And we'll get you